Good evening, everybody. Welcome to episode 42 of the SMB Talks. As you all know, this month we are trying to celebrate Mental Health Awareness Month, and we have had a couple of good sessions on mental health. So today, I have a special guest all the way from Leicester, United Kingdom. So he is a doctor. So let me give an introduction. He has got a amazing introduction here. So today my guest is none other than Dr. Raghu Raghavan. He holds a chair in mental health at the Montfort University, Leicester. His background is in health, psychology, and nursing, and his work focuses on mental health and disability, cultural diversity, participatory research, and co-production. He is the director of Mary Seacole Research Centre, an interdisciplinary research institute focusing on mental health, migration, ethnicity, and culture at De Montfort University. He is also a co-director of Leicester Centre for Mental Health Research, or LMHR, a collaborative research centre with De Montfort University, Leicestershire Partnership NHS Trust, and the University of Leicester. He has initiated and led inclusive community engagement and research on disability, mental health, resilience, well-being in the UK and in India with diverse cultural and migrant communities using innovative interdisciplinary approaches for maximizing participation and influencing impact on policy and practice. He has published widely with over 100 publications on the theme of mental health, disability, and health inequalities of diverse cultural community. So, by hearing the introduction itself, you know that what kind of conversation we are going to have, right? So we are going to talk about a lot of myths about mental health. Mental health is a subject where there are so many myths. When I was doing my research, I thought this conversation is going to go over a period of 2-3 sessions because there are so many myths around this. So without further ado, let me bring Dr. Raghu Raghavan. Hello, sir. How are you? I'm good. You're a bit away from your microphone. Yeah, it's a little bit feeble, actually. Yeah. It's better now. It's getting better now. By the way, thank you so much. Thank you so much for taking time out. And no, you are not audible now. The earlier one was better. No. No. I think the earlier one was better. Okay, 1 minute. Let me unmute your mic. I think you have muted your mic isn't connected. That's the message I'm getting. Yeah.
Now we know.
Yeah.
Can you hear me now?
Yes, fantastic. I can hear you loud and clear.
Good. Fine.
Thank you so much for joining me today, and thank you so much for saying yes to this. I have been trying to bring on speakers like you this month, especially to talk about mental health. So today, we are going to talk about. I have curated some myths about mental health, which we all believe in, and I would like your help in busting some of them at least. So if you're ready, we can start.
Okay, fine. Thank you. I don't see anybody.
Right. Actually, your volume is fluctuating.
Can you hear me now?
Yeah, this is perfect. This is perfect. Right. All right. Just to start off, today is the last session of us honoring mental health. So, mental health awareness month? So, what are your thoughts on mental health awareness across the globe? What are the trends? Some of the trends which you are observing when it comes to awareness of mental health and how to take care of mental health.
I think first of all, I must actually say about what is mental health and what is mental illness, because
Right.
obviously, mental health is not mental illness. mental illness is the result of not actually having good mental health is what we have mental illness. So
Right.
if you talk about mental health awareness, then that looks at the positive health promotion of positive mental health promotion.
Right.
So I think mental health is actually everybody has mental health.
Right.
Everybody, and we all creating that mental health in the positive
Right.
sense, in the
Right.
sense that we are able to work through the stress and strain of our lives, and we are able to try and see the difficulties in our lives on a day-to-day basis, and all the kind of traumas and experiences that we have, and is how one makes sense out of it, and how one is able to manage it and cope with it well, and see the other end of the day, really, in terms of in one
Right.
piece.
Right.
So that's a simple definition of what is mental health. And I think we all experience distress. There is
Right.
not a single person in this world who doesn't actually experience distress. So we
Right.
all experience distress. The
Right.
thing that it becomes a condition or an illness when the distress is actually experienced over a period of time, and that you're not able to manage your day-to-day activities very well, and that you're not able to function very well. That's when it actually becomes an illness. So we
Right.
all experience distress, and we all have the capacity to try and get to the other end of the
Right.
day in terms of managing it.
Right.
That's the kind of concept about mental health and mental illness.
Right.
But around the globe, I think there are loads of programs in relation to mental health awareness. Obviously, there is a World Mental Health Day on the 10th of October every year, and it's actually this week in May is also celebrated as a Mental Health Week.
Right.
But the thing is that the 85% of the world's population live in 153 low middle income countries. You're not talking
Right.
about Western countries. 85% of the population live in 153 low middle income countries, which India is also part of that.
Right.
So I think that the issue is actually in terms of resources in low middle income countries, and the kind of awareness about mental health and how to promote better mental health, and also how to understand a mental health condition.
Right.
And mental health awareness is got very loosely talked about. You think that mental health, is something. If you don't have any symptoms, you're supposed to be mentally healthy. But that is
Right.
not true at all, really, because everybody, and I think that's kind of an illusion that if you don't have any symptoms, you're mentally healthy. And I think just how one constructs one's life in terms of the stress and strain is what is actually important.
Right.
That's where mental health literacy comes in. I think we need to talk more about mental health literacy rather than mental health awareness, because mental
Right.
health awareness is a loose term. Because mental
Right.
health literacy consists of 6 different components here. One is actually having some good knowledge about what are the kind of mental health conditions that they affect both
Right.
man, woman, or children, or whatever. What are the kind of conditions that we could actually be affected by?
Right.
I think having good knowledge about that is actually very much important.
Right.
Be it in a high income country or a low income country, I think we need to actually have that. More in the
Right.
low income country because of the fact that the resources are not actually going to be there, are not there at the moment. But in the high income country, despite all the resources, we still have a higher prevalence of mental illness here. So
Right.
that's a different equation altogether. So I
Right.
think it's important to understand what are the conditions that actually affect us, and what kind of what are the kind of ways in which we can deal with it ourselves in terms of self-help modes, in terms of interventions that we can actually do that ourselves in terms of changing our mindset, and also changing the way lifestyles, etc. That is very important.
Right.
And thirdly, in terms of what kind of professionals are available, what kind of services are actually available if we were to actually seek some additional extra help to actually resolve some of those things.
Right.
So that's the third factor. And the fourth factor is actually having, in the kind of stigma around mental illness, or even talking about mental health is very stigmatic sometimes. People don't want to talk about mental health. It is the
Right.
stigma around it, the family stigma, the social stigma, the employment stigma, and all those things. So it's how we understand that stigma and how we cut across through that stigma is very important.
Right.
And fifthly, I think is actually having more information. how do we get the right information? Because there's a lot of non-relevant information about mental health and mental illness that circulate on various social media platforms. But what is the right information? How can you actually get the right kind of information? So those things actually are mental health literacy is actually more important. And it is not just having the one literacy alone that is actually important here, because people construct a number of literacies. You could be a spiritual person. You could be going to a psychiatrist or you're a psychologist or somebody. So you might still hold on to your spiritual belief systems or religious belief systems. You could actually have a different community or belief systems, etc. All those belief systems actually helps us to hold those literacies together. So mental health literacy is not just saying that psychiatry or the Western model of looking at mental illness is the only option. We have to think it more culturally. We have to think it more internationally. Different cultures express things differently. And I think the Western psychiatry is being proposed as the one model for the whole of the universe. Whether that applies to all countries is a different question. I don't think it does. So each country and everybody actually experiences and expresses their mental health symptoms differently. So I think it's important that culture is actually looked upon, because culture shapes us the way we think. So I think that's very important to do that. So from a global concept, I think there are different prevalence rates around in countries. And I think, obviously major depression. Depression is the highest prevalence. About 300 million people around the world actually experience depression. And followed by some other by the kind of depression and what we call the bipolar illness, and depression and anxiety are the kind of major disorders worldwide. The majority actually experience that. Not in terms of schizophrenia and other kind of illness are actually only tiny percentage of the people actually experience that. There are extreme forms of mental illness that some people actually experience. But majority of people actually experience mental health, anxiety and depression, and various stages of depression, both minor depression or also major depression. So I think there is that global awareness is there, but I think people don't actually address it. There are issues surrounding getting help, even in Western countries with high-income countries. There are difficulties in actually accessing services here. We had to wait for a psychiatrist or a psychologist to be seen for a number of weeks before we see somebody here, because we have a free system in the UK, whereas in other countries it might be very different. So from country to country it varies. But I think in the Indian context, there are issues in relation to how the rural and urban and tribal communities actually access mental health services. So about 1 in 4 people actually experience some sort of mental distress or mental health issue at any time in their life. That is the kind of Western way of doing it. From the Indian survey, things about 1 in 5 person experiences mental distress at some time during their life. So that is a way we try to equate the kind of what is in the global context and also in the Indian context. And a lot of problems around the world in terms of conflict, in terms of war, displacement, and a lot of other things are major factors in terms of causing mental illness. We should not look at mental illness purely from a biological perspective. We should look at it from a social cultural perspective. Because I think the society's values and other things actually are integral to it. And also the cultural values are integral to it, and how we actually, and I think all those things actually come together in terms of how we look at a person as a whole. I think in the modern psychiatry, people tend to look at people purely from a symptom perspective. That person expresses a symptom of experiencing anxiety. Yes, I mean I was very anxious before I came out of this program. That doesn't make me mentally ill. So we are all actually anxious at certain times in the day. Even any new activity that we do, we are anxious about those things. But I think we must move away from the symptomatology, looking at person purely as a symptom. We must see the person as a whole. We must see the whole holistic way of actually looking at from the religious, cultural, and the social perspective of that individual. And I think that is happening in certain parts in some of the low-income countries. That actually happens. People see as a whole, but some of the high-income countries may not like that kind of narrative in terms of how things are actually doing. So there is the politics of mental health and mental illness as well in the context.
Right, right. Even for the point itself, awareness and literacy, that itself makes so much sense. So I'm excited to have these myths ready for you so that we can clarify that and bust them as much as possible. All right. So getting into the myths, the first myth which I wanted to talk about was, most of the people believe that mental illnesses aren't even real illnesses. So what are your thoughts on that?
Mental illness it is an illness. It is an illness that many people around the world actually experience. We have enough evidence to actually show that it is an illness. And the thing is that the person it is only known to the person who actually experienced that. So if I'm
Right,
telling my story of how I experienced mental illness, that is my story. And I think, but you can't see it in the same way as like somebody is actually having a lack of oxygen, or somebody is actually having some lung infection, or your heart is not actually working. There are physical things that you could actually see. But I think in a
right,
similar way, in mental illness, majority of the stuff you might not, it is not, you can't see it.
right,
You have to rely on the person reporting it, or you have to
right,
rely on the person's relative or friend reporting that, because if the person is not able to talk about those things. So I think
right,
that the two context really. So, but I think it is an illness. There are, because we have established forms of treatment, we have established forms of support mechanisms, and all those things are actually being well researched around the world in terms of global mental health perspective. So they are real, but I think people have to trust that actually exists. But
right,
when somebody says that I'm feeling very anxious, or when a child says that I can't sit for this exam because I'm feeling very anxious, I mean, we push somebody into that process. We don't listen to those people. And
right,
I think it's important that we provide a supportive environment when somebody is actually feeling down, or somebody is actually really depressed in relation to certain things, or somebody is feeling very anxious, or somebody is actually showing other symptoms that are actually relating to that, feeling very paranoid about things, or feeling that you can't go out, be that kind of obsessive compulsive stuff or whatever. So I think we must try and understand that. And it is not
right,
it is, I think it's a holistic, the way I said, it's a holistic thing, because the individual reports those things who is actually closer to that individual, i.e. the family member, the friend networks or social networks. They have a responsibility also to try and understand that. The family
right,
is integral to this concept, because they would know what the person's behavior was like a week ago, or 2 weeks ago, or a month ago, and now what the person's behavior is like. You can see the person is not actually self-caring, or is not talking the right way, or all those kind of things. We can actually see that there is a change in the person's behavior,
right,
and also the thinking patterns and thought patterns, etc. So I think it's
right,
important for the family or the closer networks to actually look at that. And also the employer, if somebody is actually working in an employment context, employer has a responsibility as well in terms of looking after the mental health of the employees and providing the best support possible as well. So, but mental illness is real. It does actually happen. Many people actually experience it. But not all people actually experience mental illness, but all people experience mental distress at some time in their lives. But no, that
right,
doesn't mean to say that you're mentally ill. Okay,
right,
I have experienced mental distress, as I said, today and yesterday, and I might actually experience it tomorrow. But I think many
right,
other people might not be able to. You can look beyond that, but some people are actually in that state, and then I think you might need more time. You might require more treatment to actually get through that process. It is real. This actually happens. There is enough scientific advice and evidence in relation to it, and there is also, it is culturally known as well. It has been there from time immemorial. It did not just start in the last 50 years or last 100 years. We have
right,
anecdotal evidence from history, from our cultural heritage. There are enough accounts of how mental health and mental illness actually exist in communities, in people, and how it might be interfering with the kind of it is a kind of a massive the global the index in terms of health problems. It's a massive burden for the world as such, in terms of the number of days that are actually lost in terms of employment, in terms of work, etc., by people who might be actually going sick as a result of mental health issues. And hence, it
right,
is an important issue to be addressed. It is not taken something to be very lightly. It is not
Right.
just me saying that I don't feel very well today. Yes, we all feel like that. Yes, but I think
Right.
then when somebody has to lend a listening ear to that person, try and talk about why are you not feeling very well, and all those things. Yeah. So I think there is a reluctance, not just in India but around the world, to actually talk about mental illness, to talk about mental health. So
Absolutely.
it is important, and that it is important that we talk about it. And then that is why the programs such as these, which actually mainstreams the conversations around mental health and well-being. That is why it's very important. So it is real. There are treatment approaches, and there are unknown quantities as well. I'm not saying that all is fine here. There are
Right.
unknown quantities. There are major gaps. We are still learning but a number of things in terms of mental health and well-being and mental illness as well. But it is
Got
real, and there are established treatment modalities for that.
Right, right. So I hope next time before you answer, it's all in your head. You listen to this answer carefully. It's a real thing, mental illness. All right. Moving on to the second myth. Some people, while discussing about mental health, they believe that mental illness come with the birth. So is that true? What are your thoughts?
Mental illness can't. What did you say?
It comes with the birth. It's hereditary.
Right. I mean, there are some mental illnesses that might actually happen from birth onwards as well, in terms of some of the genetic abnormalities and other things that are biological factors that might actually predispose somebody. So, for
Right.
example, if the father and mother both are actually experiencing diagnosable mental illness, not mental distress, if they're actually experiencing diagnosable mental illness, then there are more chances of the son or daughter or somebody having that kind of condition. And I think both parents actually are diagnosed with mental illness, the chances are higher. If one parent is diagnosed with mental illness, then I think the chances are slightly lower, but still higher than both parents not actually being diagnosed with mental illness.
Right. Right.
So I think there are the genetic issues here in terms of how this might be a hereditary factor, but that's only a tiny percentage of it.
Right.
Okay, in terms of how this might actually build in. And also
Right.
there are things such as the disabilities actually as well, in terms of because that is also classed under the kind of mental health disorders umbrella, of learning disability, having a developmental disability. Somebody with autism or somebody with other things are also classed under these things. They actually happen from birth because of chromosomal or genetic disorders or whatever that is. There are neurodevelopmental disabilities. So I think those actually happens as a result of abnormalities actually at birth.
Got it.
Uh, so that's the reason why I think it is important that we have when for the childbirth, there is the parents are actually keeping good mental health, and they're actually eating good food, and they're actually having good exercise. They have a good mindset, and they have a good social network. There is happiness, and they're able to make meaning and sense out of their lives, etc. All those things are actually important. Pre-birth, and also during that birth, and in the Indian culture, in the Indian history, that has given utmost importance in the Indian scriptures, in terms of how absorb in terms of in the motherhood, and fatherhood, and all those kind of stuff. There are enough explanations about. So it does actually happen. It is important. It does actually happen at birth, but it's a very tiny percentage. Majority of things actually happen outside that. People develop some form of. Some people might develop at the age of 14 or the age of 25 or whatever. Depends upon the stress factors. Depends upon the conflict factors. Because number of other things that might actually add to it. That's why we
Right.
can't just purely look at from a biological perspective. But
Right.
there is a nature nurture interaction happening here, in terms
Right.
of genetics and environment, in influences that in terms of whole development, but more so in terms of the mental health issues.
Got it. Thank you so much, doctor, for that answer. All right. So moving on, third myth which I wanted to discuss with you was, there's a common belief that mental health issue cannot be cured or prevented. So I would need your help in busting that one.
Um, mental health, there is cure.
Right.
Whether there is a total cure for all illnesses, that I can't promise.
Right.
Obviously, we are still gathering enough evidence in relation to that. But I think for majority of the illnesses, that we can manage it, that it's controllable, that you can lead a satisfactory life with a mental health condition. That is the important point. Really. You could live with depression. You could live an adequate life with depression, provided the person is actually having the opportunities, the support mechanisms, and all those kind of stuff. Okay.
Right.
In the same way, a person with diabetes lives an adequate life. The same way, a person with heart disease lives an adequate life. The same way, a person with cancer or out of cancer might be leading an adequate life. The same way, you can actually live with a condition of depression. You can also lead in a condition of severe mental illness as well as possible, provided the person gets the right treatment, and the right support. And I think it's not just a treatment. Mental health is not just about popping a pill into one's mouth, like the way we cure headache. It is more than that. You have to have wider awareness. You have to see how other people's reactions are towards you. The stigma, and people don't look at you in the right way. People don't talk to you. People think that you're a strange fellow. People think that you're not able to work. People think that you should not be talked to, and all those things. They create major issues. So it is more about how other people's outlook are about the person who's actually experiencing the distress is even more important than the person experiencing the illness itself. So I think in a way, the way we look at it, mental health and mental illness, society has to change in many ways. But who is society in the first place? It's you and me who is a society. So the timeline, a few months ago, I think it was last year, I was talking to a university in India, and then somebody actually said, "Oh, it is not our responsibility. Society has to change. Government has to change." But who is society? Who is government? It is us. We change our attitudes. We change our attitudes, and together we can collectively change the society's attitude. But it is not somebody else's responsibility to change our attitude. So I think it's important that we all realize that. That is the point. It is our responsibility that if we change our mindset, if 10 people changes their mindset in terms of mental health, literacy, and mental health and illness, then I think then they would actually support people adequately. So I think it's important to try and look at that from that perspective. A family changes their attitude in relation to the major notion that there is somebody in the family who might be experiencing anxiety, whereas as a child in the family with a disability, then the girl in the family can be married off. Who says that? Who says that? Who makes these norms? They're nonsense, utterly foolish. And I think it's important that we time in this modern age, we need to move around. What is literacy all about? Literacy is all about understanding the whole concept and how we move on from those contexts. So I think it is creating that knowledge. It is creating that confidence that I can manage this, and I can manage the person. I can move on in my life, come what may. Is having that courage. The same way as one with heart disease might, a condition might actually say that, okay, I'm going to take a little walk. I'm going to actually adventure into certain things, etc. It is having the confidence. But here, other people have to support the person as
well. Right. That's a very, very amazing answer, if you ask me. That's fantastic. We all have to change our attitude towards mental health and mental health awareness. Right. The fourth myth which I wanted to discuss with you is the belief that therapy and self-prevention are a fad and they do not work. So what are your thoughts on that?
Who said that? I want to find the person who said that. I think therapy and all those things are not fad. They are real. I think they are there for a particular reason. They are there. People have actually used them worldwide, and people have experienced benefits from that. Right. The benefit can vary. I think it can. Not everything actually works the same way. In the same ways, like the normal tablets that you take for any kind of the same thing doesn't work for everybody. So there are different ways as to how things might actually work for each person. Right. Whereas I think in the field of mental health and mental illness, and I think we have to combine with maybe there are medications that may be taken. There are you need to try and control the kind of hormonal mechanisms in a way. You also need to kind of have the talking therapy alongside it. If I may put it that way, there are various types of talking therapies. There are not talking therapies. There are loose terminology which comprises of number of therapeutic modalities. So if we combine them together, the success rates are better. And that we have known for the last 50 or 60 years. We have got evidence about that. The combination therapies actually work better. other than just
Right.
medication on alone. And the combination therapies and the family awareness and the immediate awareness of other people around that individual, if they're actually able to support the person, the success is far greater as well. Okay,
Right.
so but having said that, I think there are certain, you tend to have some kind of illness. There are therapy. So none of these things might actually work in extreme format, and I think that does actually happen here too. And I think, but in those cases, you actually can actually make the person's life as comfortable as possible for that person. And that person doesn't have to be living in a prison or in a locked up environment or anything like that. I think they can have an ordinary environment, and how that person is actually supported. So I think therapy is not actually fad. It is actually a valuable, evidence-based intervention that we can very confidently approach. And there are things such as cognitive behavior therapies, which are widely prevalent and which are widely beneficial for people. It's not just the therapy on its own. There are things such as, the traditional kind of things, yoga, meditation, creative therapies such as arts, music, and other things. All those things are actually helpful here as well. It is not just therapy things. So
Right.
you have to engage yourself, because
Right.
you have to work towards getting better here. So I think you have to put an effort in it in the context as well. I think in terms of anxiety and depression, some of the other illnesses where you are able to try and make an effort here. So then
Right.
I think you are able to understand what those things are. And you're able to understand what those thought mechanisms are. You're able to understand what those anxiety triggers are, etc. So then some of those help modalities might be actually also beneficial alongside the therapeutic modalities.
Right.
But I think in some minor cases, self-help alone might be helpful as well. So you don't necessarily have to go and spend a lot of money to see a therapist, perhaps. But I think you might be able to actually address that yourself. But very much, yeah, that is an individual decision. We can't collectively say this works for everybody. So you have to make the decision, informed decision, as to what works for you and
Right.
what is it that you need after consultation with a professional.
Absolutely. So I'm pretty sure that therapies work, and it is kind of a effort from your end as well as from your uh, professionals help you can get better. Fifth myth, which I don't know, my psychologists and psychiatrist friends may agree or may not agree with it, but I had to ask this. There's a common belief among people that mental health professionals, which is basically psychologists, psychiatrists, etc., they make a lot of money off people suffering from mental health. So, what are your thoughts on the same?
I'm not sure about whether they make a lot of money from that, and because I think their professionals are there for a reason.
Right, right,
Professionals are there for a reason, and I think whether they are actually in government medicine government services, or what we or government funded services, or in private practice, they are there for a reason, for this, for as a trained professional in a particular discipline. And that
right,
applies to psychiatry, that applies to other forms of illness as well, that applies to heart disease, that applies to cancer related stuff, or that applies to infections or other things as well. All the things actually related to that. But I think from a broader mental health perspective, everybody, we have a moral and a social responsibility to actually provide intervention, be it
right,
free or be it paid. And I think that is the case here in terms of how we try and provide those things. Otherwise, I think if somebody is actually providing a valuable service, then, and I think they're actually charging a cost for that particular practice in terms of private practice, that then I'm not here to judge any of those things, but from a quality basis, everybody has to make a living. And I think everybody has got a charge to pay in the same way. And the IT guys actually charge you X number of money for developing a program. You happily dish that out. So why
right,
not a psychologist, or why not a psychiatrist who actually trying to understand your mechanisms and or your well-being? So I think that
right,
is very important. So, but I
right,
think it's important that we provide a service for everybody, and especially in the low middle income countries, there are shortage of resources. There are not many professionals, and there are a lot of charities in India that I know who provide free service
right,
for communities as well. both in the rural communities and tribal communities. There are free mental health services from not a single penny, not a single paisa, I should say. Not a single paisa is actually being given for that. So I think
Right.
that those services also exist, both in India, quite a number of organizations in India, but also in other countries as well. But I think
Right.
it's a service. If you're delivering a service, then there is a fee that you pay. I think you need to look at that from that dimension. But are you getting better is a question that you should be asking,
Right.
not in relation to the money that you're paying. Are you getting better? If you're not getting
Right.
better, then you need to go to somebody who might be actually getting better for you. So you have the choice. You
Right.
need to exercise that choice. But don't just blame the person because you paid X number of money to that person. If you haven't got better with that, then you find somebody else. You find why it's not actually working.
Right. It actually is a joint effort. Not only a therapist, you also have to put in efforts. Like doctor mentioned last question, you also have to invest time and effort from your end, to get better. All right. So sixth myth, which I wanted to discuss. This is a common belief. I've heard it from people saying these words as a joke, etc. So it's a common belief that people believe people suffering from mental illness are naturally violent and they belong in hospitals. So what is your take on that?
Not everybody, no. I would my view, and also from scientific evidence, that we know that is not true. But there are certain types of illness, there are certain conditions um, that proceed to be violent or aggressive in some way because of the illness itself. Really, it's not
Right.
you as and I think so that under those circumstances, then I think that person might require a secure in a ward or environment where the person need to be in terms of containing. But that doesn't need to say that that person requires treatment. He should be locked up and then just be ignored. The person
Right.
should be receiving adequate treatment as any other person, so
Right.
that the person is able to control some of those things.
Right.
In the anger and other mechanisms, because anger and anger management can be done, it can be dealt with people.
Right.
And in extreme cases, I know a person might be out of reality in certain contexts, but I think in other circumstances, there is a need to control what is actually happening around the person, and then make the situation better for the person to improve those things. But there are limited number of conditions where that violence and aggression might actually happen. The other
Right.
conditions are in relation to some of the alcohol-related mental illness, because alcohol also if you consume excessive amounts of alcohol, then that also causes mental illness. So alcohol is not a relaxant. Alcohol is a depressant. So, but a moderate intake might be beneficial, but I don't know. But I think so. It's important that if you consume excessive amounts of it, then that actually makes you very aggressive.
Right.
And also substance abuse, drugs or substance abuse also makes you very aggressive, and also violent behavior as well. And then in addition to that, you might also become mentally ill as a result of all those things too. So I think,
Right.
because the media is the culprit here. The media
Right.
portrays a very negative image of somebody with mental illness. And I think
Right.
the media always portrays a person with mental illness with violence. So that person who has had mental illness has killed a person. Whereas somebody else, in a war, somebody else, because of their supremacy, they're killing thousands. They don't worry about that. They kill about one
Right.
person, kill somebody
Right.
else or because of their illness or misunderstanding. So the media has a major role. Media need to be educated in terms of what is mental illness and what is mental health and what are the kind of stuff here. They don't know anything about it. So I think it
Right.
is important before they actually write about in the media about the known cases of mental illness. I think they need to think twice as to how they need to provide a better story, and they need to provide a realistic story around a person with mental illness and their families. And I think that's a huge responsibility, both the social media and also the print and the visual media as well.
Right. All right. That's fantastic to hear such a good take on that. Right. The seventh myth, which is kind of a follow up to that, it's a myth which needs a real hard look at. It's a common belief that we cannot do anything for individuals suffering from mental health issues. So, what are your thoughts on that?
Who said that again? Um, okay. It's I think you can do everything that you can do for the person with mental illness or the person with disability.
Right.
And I think you have to do everything for the person to actually make the person better. And I think it is only through that you can actually do that. But I think in the same way, you do everything for your family member who has got cancer. You do everything possible for the family member who is actually experiencing stroke. You do
Right.
everything for the same person who might actually experience a heart problem or diabetes or whatever. So why not mental illness? I think you can get better. You can recover from mental illness. You might actually have some symptoms. You might actually have, you might still feel down certain days, etc. But you can still lead an adequate life. You can still find happiness in your life. All those things are possible. You can still recover from some of those things, and then you can lead a better life. So I think it's important that we must provide whatever support and whatever help that is possible for a person experiencing distress and also a person having mental health issues as well. So I think
Right.
it is vital. We should never ignore them. We should never call them names. We should never call them socially. We should never isolate them. We should be with them. We should try and protect them in the best way possible, and we should provide them the best treatment in a way that was available to anybody with physical illness as well. And I think the other thing is actually the physical illness. Some of the physical illness can also cause mental illness, and some of the mental illness can also cause physical illness. So there is that.
Absolutely.
So you need to bear that in mind. In terms of some people with mental illness might also have a heart condition, and may develop a heart condition later on some of the psychotropic medication, some of the antipsychotic medication, does actually increase the heart rate in some ways as well. So medication do actually have side effects. So it is important that the person is actually monitored regularly. The person is actually seeing a professional, a registered professional who is able to monitor all those things, and blood levels, and those things are very important, because otherwise the person might be in danger if you don't actually pay much attention to that person. So I think the medication regime has to be carefully controlled, carefully regulated, and should take that should be gradually reduced so that other kind of self-help and therapeutic modalities can take its place.
Right, right. I'm pretty sure people who are watching and people who are going to watch the YouTube video later, once I put it live, are going to benefit a lot from these, because what I'm hearing from you is many of the thoughts which we all have because of the lack of awareness. Sometimes a friend calls and tells you certain things about his situation, his anxiety. We might have this tendency to ignore it, or don't give the right, even not even listening to them properly. So I think these answers will really, really help everybody. All right. So next myth which I wanted to discuss with you was the belief that children cannot have mental health issues. So what are your thoughts on that, doctor?
Well, children are very susceptible to mental illness. Nearly 50% of mental illness actually happens before the age of 14. Or the other percentage actually happens before the age of 24. So I think you do develop mental illness at a very early age. If some of them, and I think. So what is that doesn't mean to say that because everybody is susceptible to it. All children are susceptible to it. And obviously, with the genetic conditions and other things, people with disabilities are more susceptible to it. People with learning disabilities, people with developmental disabilities, people with autism, etc. People with autism are feeling highly anxious about
Right.
things as well. So I think there is a high anxiety issue associated with autism. There are other mental health issues associated with developmental disabilities as well. So it is not. I mean, I think so. Altogether, there are issues in relation to how a young person's life need to be well managed. So I think what should actually happen is that rather than looking at the problem, I think we might actually the prevention is always better than cure. So I think for children, I think you need to provide them a safe environment. You need to actually have an opportunity to talk about things and issues. Gain, the schooling. And I know India is a country where a lot of pressure is actually put on children. I've been a victim of that myself in my younger days myself as well. So I think it's just how excessive pressure is actually put on children, that you must actually get X number of grades. If you come home without 100%, then parents often ask what actually happened. Why did you get 110%? So I think so they're under severe pressure to perform, and again to actually achieve certain things and whatever. So I think you could have some kind of a relaxation there in terms of high pressure often builds up stress and strain and sadness and other things because the person is not able to achieve in relation to the expectation of their parents, in their expectation of their peers, etc. All these things are trigger factors for young people. So you need to provide a kind of an environment where they're actually able to articulate that, able to talk about these things, and also say, a safe environment with the parents and good food, no junk food, good food, good balanced diet, exercise, and the ability to engage in creative arts, dance, drama, arts, and cricket or football or whatever. All those kind of things need to be encouraged as well, and also social networks. And so because we have a problem here in the Western world as well in relation to a number of people are hooked on social media. And one would actually have expected that if you have 5,000 friends on the social media and you're still feeling very lonely as a result of it. So there's something wrong with the media or something wrong with how you actually operate on the context. So loneliness, I think children sometimes actually feel very lonely and socially isolated because of the environment in which they live, because of the family context, or a number of other things as well. I think it's important that we provide that, we look at that and cherish a young person's life in the best way possible, and then provide them the best education, but not pressurize them to do what we want them to do, get them to do what they want them to do. And I think that is very crucial, so that then they don't have the stress and strain of other things. They already have the stress and strain of actually going to school and having to socialize and having to meet and having to perform and all those things that don't provide undue pressure to young people, to children.
Right.
Because I think it is a developmental age whereby you have to provide the best care, the best help, and the best outlook for that person. And I think it is crucial that we look at that in the positive sense.
Right. I hope every parent is listening to this because it's some of the tendencies which we have as a parent to do all these kind of things. All right. So the ninth myth, we have one more myth to go. So ninth myth about mental health is the belief that only certain type of individuals experience mental health issues. What do you have to say to those folks?
No, that is not true. In the sense that everybody actually can experience mental health. Everybody experiences mental health. Everybody is also able to actually experience mental distress and mental illness as well. So I think the thing is that the WHO talks about there is no health without mental health. So which actually makes sure that the physical health and mental health are actually looked upon as one continuum of things, not as a separate entity. So it's important to see that as a totality of the person's life. So I think in terms of some people might be more susceptible to actually experience depression or anxiety because there are some genetic factors. Say, for example, children with autism, and when they grow into adulthood, they are more susceptible to be more anxious. And there are things that we still don't know why that actually happens. So there are still a lot of unknowns in the field as well, in terms of there is not enough evidence for us to say this is the reason why that is actually happening. So, but I think it more or less, I think we can all actually experience it, but I think the environment in which the person is actually there, more than the genetics and this thing, the environment may be a major trigger factor. Conflict-ridden environments might actually make somebody more prone to develop mental illness, child or adult. Say, for example, if you have family background in terms of the parent, the father is an alcoholic or mother is an alcoholic or whatever, that might actually be a major trigger factor in terms of actually tilting the person towards mental illness or some kind of instability. So I think that there are some environmental factors, there are social factors in terms of, I am not a very good socializer. I mean, I only have 5 friends. And what do I need to actually have? But as the other person next door to me have got 20 friends, and then if I think that I'm not happy with my 5 friends, then I think I might actually feel a bit sad, and that might actually then there is an expectation on me to actually develop my friendship and network to be seen as somebody but better off than the other person. All those kind of peer pressures, especially when you're young, all those peer pressures actually tend to create some kind of a conflict, and I think so. It is important to understand that. But I can talk about all those things that because we have traveled through those journeys and got here. So
Right.
in one piece. So obviously, I think we experience all these things, but I think it's making sense of it that is important. And I think it might
Right.
take a while. It might take a while for us to make sense of it. I think that's
Right.
where the kind of relaxation, sports, and yoga and other kind of things, and engaging in creative arts and talking about things in a good, supportive friendship circles, etc., all helps us to understand what is it that we're going through. And I think you need to get that feedback. Then I think you only then need to go to the professional if you think that you're actually gone past the barrier of where you think you need to seek professional help. Some of those conditions, we all feel down, we all feel very sad, we all feel depressed one day, and you're okay the next day, and all those things actually happen in one day itself.
Right.
So I think it is taking stock of those things and that sadness and other things. And I think it's also having a sense of purpose in life. It's also about having a sense of happiness in life. You,
Right.
you, you, and you alone can create that happiness, not anybody else.
Absolutely.
So I think it's important that to have that understanding. You are, where there is the old Eastern philosophy, the old Indian saying, everything is actually within you. That is very true in relation to you create your own happiness, you create your own
Right.
well-being, you create your own things. And I think it's important to understand that. And that's where some of the feedback comes in from other people to understand yourself and how you create meaning, and how then you can then understand your own physical and mental health and well-being. And
Right.
resilience is also a concept here. How you create, because with all this trauma that actually one goes through, you create resilience. You grow out of it. You come out of it in one piece. You bounce back. You have had X number of things. Your parents might have been very unwell. You have had to care for them, or your parents have been, maybe there are mother issues, or the marriage has been split up, or whatever. Really, there are a number of issues that be happening. How does a child or a young person grow out of it, and how do you try that? And all those things are good stories of resilience. So
Right.
just because a person comes from a very high conflict environment does not mean to say that the person is actually able to will be mentally ill or will be experiencing mental distress all their lifetime. You can create that. You can create a different narrative. You can create a positive narrative. That very much depends upon how you operate within that kind of context, how you
Right.
understand things, and what your support mechanisms are.
Right, right, absolutely. That's a fantastic answer for that question. The final myth which I wanted to discuss with you today is, because we are all stuck with this pandemic right now. There's a common belief nowadays, that it is impossible to get treatment for mental health issues during this pandemic. What are your thoughts on that?
I think that is true. That is very true, not just in India. That is true, true here as well. We have been in the UK. We have been through 3 lockdowns so far,
Right,
and so during the pandemic period, obviously hospitals were not actually being accessed for people with severe mental illness. It was difficult for them to actually access and mental health services. And they could not even go and see the GP, general practitioner, in terms of the first protocol here in getting through the system of seeing a specialist or professional help. So that was not possible. But I think because the events have overtaken, not because of you and me or anything else, because I think that's how nature has operated. So it's beyond our control here. It's important to understand that it's beyond our control. Situations have overtaken beyond our control. So I think it's important to understand that context. And then
right,
yes, then I think there are people who actually do online therapy, online conversations under these contexts. So you may not necessarily be able to speak to somebody face to face, but I think there are other options available. Digital technology has actually improved over the last year in terms of
right,
therapeutic policies, and I think that's important to use that. But I think just because the pandemic certainly has had a major impact, both in all parts of the world, in terms of mental health, and also people are becoming more aware of mental health and well-being in the pandemic. So there is a
right,
positive slant to it as well in terms of
right,
understanding that as to how there are difficulties that are actually experienced in the first. I mean, I think because of the lockdown, you can't actually go out, and the stress that you experience, you can't talk to other people, etc. There are issues surrounding that as well. But I think it's important that you use your imagination, you use your inventiveness, you use your connectivity, you use your resourcefulness to overcome some of those things. You have the most up-to-date digital technology in your hand. Connect with
Right.
people and talk to people
Right.
with that. And there's hundreds
Right.
of thousands of users to that. And I think so. I think you have to be very imaginative in how you operate to that. Okay, yeah, not everybody has got a smartphone. I understand that. There are people within rural communities. There are people within tribal communities, and who actually experience some of those things as well. And I think they might not actually be able to seek the right kind of help and support. But there are some other charities that actually work with those people, providing those services in the best possible way. But I think yes, it is an issue. We are living through that at the moment as we speak, and I think it is one thing that we should bear in mind is that the pandemic is yes there. It's been here for the last year and a half, but we need to see beyond it. It will go one day. I can't predict. I can't predict when it is going to go, unfortunately. But I think we have to visualize beyond the pandemic. We
Right.
can, and I think we need to make sense out of it. We need to contextualize it. We need to see that we can function in whatever. There are limitations. I can't go and see anybody else, and I can't go to my office when I've been sitting in my office and operating my work around the world from here. And I don't. And some people have to go to work to earn a living. I know people. I think for them it is very difficult. So
Right.
there are issues around it, and I think, but it is easy for me to sit down and say, think positive. And I think the positive psychologist land of think positive, yes. But I think, yeah, but there is some sense in it. You need to make some positive sense out of what is actually happening current now. So it is
Right.
only making some positive sense that you can actually create that happiness and well-being.
Absolutely. So those were 10 myths. Some of them we busted. Some of them we added a new perspective from doctor. So now I want to ask a personal question to you. You wear multiple hats when it comes to your work. You are a chair at Dr. Montfort University. You're also director at Seacole Research Centre. It will be fantastic if you can share some information about the work you're currently doing, especially from the disability, cultural diversity perspective. It will be fantastic to hear that.
Okay. Right. I'm a researcher. I used to practice. I used to work in the health service here a long time ago. But I've been an academic for the last 20 odd years here. So I normally say I'm paid to think. I'm paid to think. I'm paid to think the impossible in terms of how things work out and how to find meanings in relation to things. So I'm a professor. I've come through all academic ladders in terms of I've been a lecturer. I've taught students, and now I don't teach that many students, but I have a lot of PhD students who actually work with me. So I have my main job is actually trying to do research work within the UK and in India and also in other parts of the world as well. So we currently work. We have a vested interest in culture and mental health because culture influences the way we shape understandings, etc. So
Absolutely.
in the UK, we work with people from different cultural communities, people who are actually from India, Pakistan, Bangladesh, people from Africa and many other countries as well, who are what we call the minority ethnic communities in the UK. And obviously, there is abundance of racism, there is abundance of discrimination, there is abundance of everything here in terms of different people of different colors.
Right.
So mental health, there is like a lesser awareness of mental health for people from those minority communities. They don't actually go to the mental health services that is already here. My research concerns around how we make them a better understanding about those things and how we enable them to actually access mental health services. And also,
Right.
I've worked in the field of disabilities. I worked with people with severe disabilities, severe learning disabilities, and mental illness, and also people with autism in my previous incarnation as I started my career through that. And I think so. We're also working with the families and people with disabilities in terms of mental health and what are the best ways of actually approaching their issues, etc. And
Right.
I'm interested in the cultural concept of things, in how we make cultural meanings of mental health, cultural narratives about mental health. As I said to you earlier on, it is not just looking at the symptom. You're looking at a person. You're looking at a community. So we have a couple of projects in India. We completed a project in India in Pune on how do slum dwelling communities construct resilience, because they are under severe trauma. They're
Yep.
living, and I think, but there is happiness. There is happiness that they construct themselves in the midst of all those trauma. So we were able to tell that story, because everybody thinks that living in a slum is, yeah, there are market issues, and they have a number of mental health issues, and they're all anxious, they're all depressed. Yeah, okay, fine. So but how do they construct? They are living there. They're still standing, and there's a story to be told. So we used a drama, used community theatre as a modality of working with those little communities and trying to tell their stories of resilience. Because the problem is, in research, I think it doesn't have to be all neatly driven data sets.
Right.
My story is also a data, and people's
Right.
story is also a data. So I think
Absolutely.
you need to tell the stories, and I think research through storytelling is what I'm trying to perfect in relation to how we tell the stories and how we enable people to tell the stories. I'm not doing research to people. I'm doing research with people. I want to engage with people. I want to communicate with them. I want to hold their hand. I want to work with them. And I think that's the way we actually do. And we have a big project in Kerala, in southern India, where we have work on mental health literacy in urban and rural communities. And I think that is coming to the end of that stage in October. That will finish. We've done quite a bit of theatre. That also does theatre, film, and digital storytelling and other things as well. So we were planning to actually come to Kerala, but this is pre-March conversation. But now we suddenly realize that we may not be able to get there before October. So we want to use digital technology to try and see how some of those things. We have kept that project going through digital technology. We have kept meetings going every week. So all those things are possible. I mean, I've done all those things from here. So it is important that I think the will, I think, is bringing people together. If you have a medium, we can bring people together, enable a lot of, because we have people working in India with us, research fellows and research assistants. And sometimes they tell, oh, it's not possible. It's all lockdown, sir. We can't do anything. No, you can. You can think. You can think. It doesn't cost you anything. You don't have to go out to think. You can write. You can do things. So all those things are possible. So I think we even run a film festival in the midst of the last lockdown. We ran a film festival as well in the Indian context in Kerala as well. So that we kind of work around those things. However, my kind of idea is that to mainstream that mental health conversations, how we create mental health literacy. So I'm trying to actually link up with various universities in India, various organizations in India, in terms of how we can take on the work of mental health literacy and try little projects and trying to get a better impact about the project in trying to see how this is actually shaping up in the next 10 years. So I think that is the agenda that I have. I want 300, how many, I don't know, the kind of 1 point, I know I can't get the 1.3 billion people to talk about mental health, but I know I can get 1,000 people to talk about mental health issues. And that is okay for me.
I'm pretty sure you're touching more than that number at the moment. And I completely agree with the statement which you said that you are paid to think the impossible. You are doing impossible things. I'm so glad to hear that. Maybe next time you're in Kerala, I might catch up. I'm from Kerala also. So I might get a chance to meet you. All right. My final question. This I ask all my guests because this show was started in midst the pandemic. So how has COVID-19 impacted? You already mentioned about a little bit about how it impacted your work, but how has it impacted you as a person, professionally, and how is 2021 looking up in UK?
Yes, obviously, when the pandemic has impacted on our lifestyles and our work thing as well here. Lifestyles in the sense that obviously, I used to be a frequent flyer to a number of countries, and I'm not able to do that. But okay, so I'm the positive slant to that. Obviously, there is an environmental. I'm very carbon conscious. Obviously, there is I don't have to spend all that money on petrol or diesel or plane fare. So, but I can sit here and talk to all those people without those things. So there is make use of the opportunities available to you. So I think in a made sense of I've done all the things that I used to do. For me, I think that has an influence. And I think that I'm not an exception. I just felt very motivated, and I have to do those things, and I have to do X, Y, and Z, come what may. And I think that may have actually helped me to get. And I also having a supportive family is also a very very good thing here. And I think
Absolutely.
so I think we are fortunate to actually have those things. But I think it just you have to be, in the life. Tell you an example. In the middle of the pandemic here, in the middle of the lockdown here, we even cooked up. We even worked through the health minister and the prime minister and other agencies in a tiny country called Guyana in South America.
Right.
Okay, Guyana in South America is the country where they have. I think they used to be the second highest number of suicide rates in the entire world. Okay, it used to be the
Okay.
first, but I think it gradually come down. So I think we were trying to look at mental health systems and how we can bring in some of the indigenous communities, the rural communities, etc., to talk about mental health, and because they have a very old mental health system, so we're trying to see how that could be worked on. So you were able to talk to people purely on digital technology and connect with people and all those things. So it is possible. I mean, you got it in your hand. You got your mobile phones and you got other things. Use those resources wisely. I mean, I know not everything can be possible, not everybody able to do that, but I think just do those things. And I like gardening, and I like doing X, Y, and Z. So I think keep myself engaged through my daily yoga and other things as well. So that it's not work all the way. You have to think outside of work. You have to think
Right.
outside of work. You have to make meaning out of things. You have to see. And I think the pandemic, it is difficult. I know even I was okay with it, but I think even now, towards the end of last year, towards the beginning of this year, I was also feeling the thing that why you do want to go out. I don't, because you normally go to only to the supermarket. You don't go anywhere else. So I do want to go out. I do want to see some people. I don't want to see my friends. But it's not possible. So but you just have to look at other ways of actually doing it.
Right.
So I'm not saying that it's I made some sense out of it myself, and
Yeah.
I've had some success with it as well. So,
Right.
but that may not be the case for everybody. I know, but that I'm just telling my
Absolutely.
story. My story is not
Right.
everyone else's story.
Right. Yeah, I love the way at least you put a positive spin on it, because that's what is needed these days. Now, there is no other way for us. We have to go through this. So, and thank you so much, Doctor, for taking time out today and sharing all these valuable insights. I enjoyed this conversation. Thank you so much. Stay safe. Thank you.
Thank you very much. Yeah, thank you for having me. Yeah. Bye bye.
All right, so that was Dr. Raghu Raghavan. I enjoyed the conversation. I'm so grateful for people like him, right? Because mental health is a topic which we all ignore. I have a friend, my college friend, who is suffering from mental health illness from the time he was graduating. So he still calls me fortnightly once to just talk about the simple things he is able to do. And I pick up his call. For last 2 days, I've not picked up his call, and I feel so sorry about that. He calls me, I listen to him, we chat about biryani in Tamil Nadu and things like that. So that's all we can do, right? We can be there for people who are facing some challenges. We all do this, right? So we have to figure out whether it's a distress, like doctor said, or is it an illness. So talk to somebody who knows it, talk to somebody who can listen to you and give you the right advice. So this was my effort for spreading some amount of awareness about this mental health issues and challenges we face. So next, this May is out of the way. June, as usual, the program will continue with other stuff related to small and medium businesses. I hope to bring some interesting guests from the marketing world. I was not feeling well this week, but I wanted to do this show somehow with Dr. And listen to his insights. So I want all of you to stay safe, and I will see you all for next episode next Friday. Happy weekend, guys.